Good morning, everyone. I'm John Cummings, an MHA student, and today we're going to discuss a critical health policy intervention aimed at mitigating the devastating effects of the opioid crisis in Tennessee. This presentation builds upon the evidence base regarding the severe health challenges facing the state, particularly the interconnectedness crises among chronic illness, mental health disparities, and escalating opioid epidemic. Our goal today is to weigh potential outcomes and propose a definitive policy action. The state of Tennessee faces persistent underperformance across critical health indicators, including low life expectancy and high population morbidity. Among these challenges, the opioid epidemic stands out as both a symptom but a driver of broader systemic issues. Tennessee currently ranks 49th nationally for drug-associated deaths and experiences an overdose rate of 56 per 100,000 people. Is further complicated by the high presence of fentanyl found in 70% of toxicology reports and the vulnerability of rural areas due to limited healthcare resources. Given the severity and the complexity of this issue, effective policy development is essential. We will examine three proposed policy pathways and advocate for the one I believe offers the most comprehensive and sustainable solution for our healthcare clinicians and patients alike. To frame our decision, we must acknowledge the sheer magnitude of the crisis. Not only does Tennessee rank poorly in drug-associated deaths, but the health landscape is characterized by a heavy burden of chronic disease, ranking 45th in heart disease and 48th in multiple chronic conditions. Chronic illnesses often bring persistent pain managed with opioids, while untreated mental health issues heighten the likelihood of substance misuse, creating a reinforcing cycle, or what we call syndemic. Furthermore, the stigma against people who use drugs, whether structural, social, or self-imposed, overwhelmingly impedes access to overdose prevention and treatment. The initial analysis of this crisis proposed three evidence-based solutions: harm reduction strategies, expansion of MAT, and stigma reduction. Based on these solutions, three specific policies were proposed. First, proposed policy number 1, the Tennessee Naloxone Access Act. This act focuses on harm reduction through mandated free naloxone kits in public venues and required staff training. This is a crucial, low-cost, high-reach intervention. Second, proposed policy number 2, the Tennessee MAT Equity Initiative, focuses on expanding medication-assisted treatment by subsidizing MAT training for rural providers and offering zero copays under TennCare. This addresses the dramatic underutilization of MAT in Tennessee. Lastly, proposed policy number 3, the Tennessee Integrated Opioid Response Rule. This rule proposes balancing stigma education with enforcement measures, including mandatory reporting for repeat overdoses. This policy, however, limits standalone stigma campaigns if they are not tied to accountability. My selection is proposed policy number 2, the Tennessee MAT Equity Initiative, which targets the root problem of ecstasy and excess. The Tennessee MAT Equity Initiative aims to dramatically expand access to medicated-assisted treatment, or MAT, which involves using medications like buprenorphine alongside counseling for opioid use disorder. The initiative focuses on two critical prongs: increasing provider capacity and decreasing patient financial burden. Specifically, the policy proposes to subsidize MAT training for providers, especially those practicing in rural areas, and integrate MAT into TennCare, ensuring zero copays for low-income patients. This is a robust approach because while MAT is highly effective and cost-saving, it remains severely underutilized in Tennessee. The foundational evidence supporting this choice is undeniable. MAT dramatically reduces the risk of death for individuals with opioid use disorder. By focusing on subsidizing training, the policy directly addresses the prescriptive barriers and lack of resources that often prevent providers from offering this effective care. By eliminating copays for low-income patients, it tackles financial disparities, which are major barriers to necessary counseling and medication. My choice hinges on maximizing long-term effectiveness while strategically targeting disparities. We know that MAT is not only highly effective in reducing death risk, but it is also cost-saving. Initiating treatment, even in emergency department, has been shown to improve treatment retention. The MAT Equity Initiative leverages this powerful evidence base. Tennessee's health challenges are heavily defined by disparities. Poverty ranks 38th nationally, leading to reduced access to preventative and continuous care. Rural counties are exceptionally vulnerable due to these limited healthcare resources. The policy specifically aims to tackle these access barriers by subsidizing training for rural providers, and ensuring that life-saving treatment is not concentrated only in urban centers. While Naloxone Access Act is an invaluable for immediate fatality reduction, the MAT Equity Initiative provides a framework for sustained recovery and mortality reduction through treatment retention. Focusing solely on enforcement, as suggested by Policy 3, carries the risk of deepening stigma toward people who use drugs. Stigma is already a massive barrier, recognized as an overwhelming impeding recovery efforts. Policy 3's mandatory reporting component is also likely to generate opposition among providers who wish to avoid added administrative and reporting burdens. In contrast, the MAT Equity Initiative directly addresses the critical need for comprehensive and evidence-based management of opioid use disorder, offering both efficacy and equity. The Tennessee MAT Equity Initiative is the best choice for healthcare clinicians because it aligns clinical practice with evidence-based effectiveness while simultaneously easing logistical and financial barriers. Clinicians strongly back MAT for its proven efficacy in improving patient outcomes. This policy encourages providers to adopt a standard of care that they already recognize as superior. First, the training subsidies directly address prescribing barriers, making it easier for rural providers who often face resource constraints to become certified to offer this treatment. Furthermore, the removal of copays for low-income patients removes a major hurdle clinicians often face when trying to establish continuous care and maintain treatment retention. High out-of-network costs are already a major concern in Tennessee's mental health landscape, and this policy prevents similar financial burdens from impeding OUD treatment. Second, the expansion of MAT supports indirect stigma reduction. While Policy 3 risks increasing stigma, the act of offering compassionate evidence-based care itself is a key method for providers to reduce bias. Education, which is key to stigma reduction, also supports the adoption and utilization of MAT. By enhancing care access and offering effective treatment, clinicians can build patient trust and enhance outcomes. This integrated strategy ensures providers are operating within a supportive system that encourages evidence-based practice and minimizes the burden of seeking treatment on the patient. The critical selling point for establishing the Tennessee MAT Equity Initiative as a priority issue for advocacy and health policy development is its commitment to equity-driven efficacy. This policy guarantees that highly effective evidence-based treatment is made accessible to the most vulnerable populations in Tennessee, specifically those in rural areas and low-income groups where treatment is currently most underutilized. Advocacy needs to focus on long-term return on investment. While we must continue to advocate for harm reduction, the MAT Equity Initiative ensures that our efforts pivot from just preventing immediate death to promoting sustained recovery and better long-term health. This is vital in Tennessee, where the opioid crisis is intertwined with severe chronic disease and mental health disparities. By treating OUD effectively, we begin to interrupt this dangerous endemic cycle. Furthermore, from the policy perspective, this is a financially sound investment. MAT is proven to be cost-saving. The initial investment in subsidizing training and removing copays is offset by reducing the massive social and economic burden of untreated addiction, including deceased reliance on costly emergency interventions, hospitalizations, and law enforcement involvement. The policy builds on the existing reality that Tennesseans need consistent, coordinated care rather than a fragmented patchwork system. By integrating zero copay MAT into our TennCare, we are creating a more coordinated, value-driven system for vital service, ensuring the policy has both clinical and economic appeal. In conclusion, addressing the severe opioid epidemic in Tennessee requires innovative, integrated, and evidence-based policy frameworks. The Tennessee MAT Equity Initiative represents the best choice among the proposals. I chose it because it capitalizes on medication-assisted treatment, which dramatically reduces death risk and is recognized as both effective and cost-saving. It directly combats the major policy challenge of underutilization and limited access in highly vulnerable communities. I believe it's the optimal choice for healthcare clinicians because it supports them in practicing compassionate, high-quality, evidence-based care by eliminating financial and training barriers. It ensures that policies are feasible by involving provider input, which is key to successful implementation. Finally, its selling point is equity-driven efficacy, the commitment to making life-saving, recovery-focused treatment accessible to every Tennessean, regardless of income or geography. By stabilizing OUD through treatment, we move closer to improving Tennessee's health outcomes overall. The call to action for us as healthcare advocates is clear. We must urge state legislators and administrators to fully fund MAT training subsidies outlined in this initiative and mandate zero copays for MAT services under TennCare. Only through comprehensive, evidence-based solutions like the Tennessee MAT Equity Initiative can we hope to reverse the state's poor health trajectory and genuinely improve life expectancy. Please see the references used in making this presentation. Thank you.